Yeah, I was just going to say, talk a little bit, go back and talk a little bit about anywhere care or medical malls.
I don't know if this term exists, but I'd like to talk a little bit more about, again, the emergence of healthcare information. So I just started thinking, what if you had care anywhere? And so I call it anywhere care. And anywhere care is you can get information on your device, your mobile device. We all know that. You could be sitting on the beach in Hawaii having a margarita and find out how bad that margarita is really going to be for you if you drink too many of them. But the reality is right now, a lot of corporations are starting to realize that patients want to engage in their healthcare while they're out in the community. So it's I look at it like Walgreens. Walgreens is setting up kiosks where you can get information on not only healthcare and get products right in their store, but you'll also be able to find physicians in your local area, maybe get on and find top doctors in and find your physician in your local area, but also get direct healthcare right there in the facility to meet your specific needs. So anywhere care, anytime. So it's healthcare coming to you rather than you having to go to it.
Do you want to talk about the medical malls?
Oh my gosh, medical malls. I don't know if this term is, sure I'd like to talk about medical malls. I don't know if this is actually a real term. I thought of this after I started learning a little bit more about some cancer programs, some really interesting cancer programs. So there's a mall. Imagine you're in a mall and you can get not only your slacks or your shirt, but you can also get an examination. Well, this is actually happening. So Nordstrom's, one of the large retailers, has set up a mammogram system in a mall right there within the Nordstrom's. And so a female can go in, a lady can go in, she can get her Calvin Klein jeans or Calvin Klein suit, and I'm promoting Calvin Klein here. She can get her blouse and she can also get a mammogram. And why that's really important is it takes a lot of that stigma out of healthcare has to be done in a stale environment like a hospital or a clinic. But it also makes it accessible to people that maybe hesitated to get a mammogram before. So I think we're going to see a lot more of that as the emergence of technology and information gets out into the public. Hack a few of those things out.
How do you think what your work, what you're doing, will influence or help to influence trends in healthcare?
I'm hoping my work will influence trends in healthcare, but how my work will influence trends in healthcare, I believe, is the information that wasn't accessible to patients now will reduce that stress and that frustration that they've experienced trying to get good healthcare. So if you're asking me where our products or our systems are going to influence the trend, is we're only a small component of the healthcare trend. In other words, we're going to provide the tools and systems to accelerate the process of getting data out there to patients as well as to providers. So we're only accelerating the trends that are occurring. We're not setting the trend. But maybe you have a different question. I hate to claim the trend is my point.
Right. Yeah. Well, I think that there's a piece there.
Okay.